Hi, my name is Tom Lewis, and today I will be presenting the written case summary for Clinical Practice 1. My patient's name is William Cairns, and he presented to the Student Chiropractic Clinic with a chief complaint of sharp low back pain during weighted lunges at the gym. Will is 21 years old, lives in Mackay, and his date of birth is the 13th of the 2nd, 1999. Regarding Will's history, he's an active 21-year-old male who plays rugby league regularly and hits the gym 6 days a week. Within the last 6 months, Will has started experiencing lumbar pain whilst carrying out weighted lunges at the gym. These lunges are particularly more painful when Will has his left foot forward and when they're weighted. Will has had previous chiropractic treatment but has not had much relief. Moreover, he describes his pain as sharp and electric and rates the pain as a 6 out of 10. Regarding Will's past medical and surgical history, Will had an appendectomy performed when he was 9 years old. However, he has not since had any surgeries, illnesses or accidents that he can think of. Will does not take any medications, and regarding his family and social history, he has no family history of chronic disease such as cancer or cardiovascular disease. Additionally, regarding his psychosocial history, Will mentions that his supportive family and friends, does not suffer from any mental health problems, and occasionally he consumes 4 to 6 standard drinks on average per week, usually after a football game on a Saturday. Regarding Will's physical exam, when observing Will, he exhibited a decreased lumbar lordosis, whilst gait was unremarkable. His active range of motion was mildly restricted in left and right lateral flexion and rotation. During static palpation and lumbar springing, Will exhibited muscle guarding in the L4-5 region bilaterally. When performing Will's orthopedic testing, his slump test was negative, straight leg raise was negative over 70 degrees bilaterally, Bragard's test was negative bilaterally, and Will's sensory, motor, and reflex exam was negative and unremarkable. Will had a regular pulse of 62 beats per minute, his respiratory rate was 16 breaths per minute, temperature of 37 degrees, blood pressure was 116 over 78, and his weight was 85 kilos. So regarding Will's differential diagnosis, working diagnosis, and then his differential diagnosis, I came up with 3. So my final diagnosis for Will, I believe that Will is suffering from a chronic episodic lumbar L4-5 moderate muscle strain bilaterally. This is due to the fact that he only experiences symptoms after completing weighted lunges at the gym, and the issue usually resolves itself within a couple of days. Additionally, Will did not have any radiculopathies, and pain was centralized to the musculature of the L4-5 lumbar region. Moreover, Will's sensory motor and reflex exam was unremarkable, which indicates no neural involvement. My first differential diagnosis was the fact that Will could be suffering from a chronic episodic lumbar L4-5 moderate facet strain bilaterally. This was due to his restricted range of motion in lumbar lateral flexion and rotation. Will also exhibited pain and muscle guarding during lumbar springing, which could indicate joint mobility dysfunction. His second differential diagnosis, I believe that Will could be suffering from a chronic episodic lumbar L4-5 moderate ligamentous strain bilaterally. This is due to muscle guarding and pain during lumbar springing, this is due to the sudden onset of his symptoms that usually resolve within a few days of onset. Regarding my plan of management for Will, so this management plan that I wrote out for Will was in accordance with the National Health and Medical Research Council guidelines, evidence-based management of acute musculoskeletal pain. Specifically, this management plan related to Section 4, the management plan for acute musculoskeletal pain. So a lumbar strain will usually improve within a lumbar muscle strain will usually improve within a fortnight of onset. Additionally, normal function is usually restored within 6 to 8 weeks. So for treatment for Will's condition, I would like to see Will for 6 to 8 treatments over an 8-week period. Week 0 to 2 will involve instrument-assisted soft tissue mobilization therapy on his erector spinae muscles. This is to loosen the musculature in that area so that he can get some relief and so that it's not so tight, because I did recognise that and see that he was super guarded throughout that area during his physical examination. This will progress, so once I've finished doing the instrument-assisted soft tissue mobilisation, this will progress to lumbar springing and palpation to determine if there are any restrictions in the lumbar spine. If restrictions are found, I would perform spinal manipulative therapy, and then to rehabilitate this area, tissue-sparing regional range of motion exercises and PNF stretching will be carried out. It will also be recommended that Will reduce the amount of weight he is lifting during his weighted lunges at the gym to limit the chance of re-injury. Moreover, at-home advice for Will involves him completing lumbar exercises to strengthen his lumbar musculature. So these at-home lumbar exercises will include a supine abdominal draw-in. Abdominal draw-ins with knee to chest and side bridging on the elbow. And these exercises will be performed twice daily for 2-minute intervals, totaling no longer than a 10-minute period. So moving on from week 0 to 2, in weeks 2 to 4, I will continue providing Will with instrument-assisted soft tissue mobilisation, as well as spinal manipulative therapy if initial range of motion and palpation findings provide a case for this. Rehab during this time will also include range of motion exercises and PNF stretching. Additionally, a side bridging stretch will be introduced to Will's at-home care, and this will involve single leg hip abduction, which will also enable him to strengthen that musculature in the lumbar spine. In weeks 4 to 6, instrument-assisted soft tissue mobilisation will continue to be provided, as well as spinal manipulative therapy if range of motion and palpation findings provide a case for this. His rehab during this time will include range of motion exercises and PNF stretching as well. And then there will be a bridging exercise where the head is placed on an exercise ball. And this, I'll show Will how to do this, and I will also add this to his at-home care. So if his symptoms were improving, I would resume normal treatment periods. So in order to measure Will's progression of his pain symptoms and whether or not he's improving throughout this period, every time he comes to me for a new treatment, I will get him to complete a numeric pain rating scale, and we will use that to inform us whether or not he's improving. Additionally, I will conduct range of motion exercises, as I said, and go over some physical stuff to see whether or not he's getting more getting improvement throughout this period. So in weeks 6 to 8, I will still continue with instrument-assisted soft tissue mobilisation on the erector spinae muscles. I will continue spinal manipulative therapy if initial range of motion and palpation findings provide a case. And then for rehab during this time, I will still continue range of motion exercises and PNF stretching. Additionally, Will could continue performing the lumbar core strengthening exercises. However, these recommendations will be dependent on the outcome of his patient-reported outcome measures, such as the numeric pain rating scale that I mentioned earlier. Regarding Will's prognosis, Will's lumbar muscle sprain should improve within a fortnight of onset. However, this is under the provision that he reduces the amount of weight he is lifting during his lunges and carries out the recommended at-home activities specified in his management plan. So luckily, his lower back pain, it only occurs when he's doing weighted lunges at the gym, this sharp electric pain. So if he reduces the amount of weight that he's lifting during these weighted lunges and strengthens the musculature in his lumbar spine, surely this should see a reduction in his pain. Additionally, I would also conduct an ergonomic exercise where I would ask him to perform the weight in front of me to reproduce his symptoms, and then we would see if we could, carry out some ergonomic practices that I could show him and ensure that he's guarding his abdomen correctly, embracing himself whilst conducting those weighted lunges to ensure that he is lifting correctly and he's not placing any unnecessary or undue strain on his lumbar spine during those weighted lunges. So additionally, I'll be providing Will with spinal manipulative therapy. This could also improve his lumbar spine pain. That'd be on the provision that I found restrictions during palpation or range of motion. While treating Will. As I said previously, I would use the numeric pain rating scale and the Oswestry Disability Index to determine if treatment modalities were improving Will's condition. Additionally, I wouldn't order any further investigations because everything sort of points to a muscle strain in this indication. That is pretty much all I would do for Will.